We are going to demonstrate a 3M PICC dressing change with step-by-step instructions. So initially you're going to enter the room, you're going to have your stainless steel cart, and we are going to clean our cart. And always make sure that we're using our stainless steel carts as our work surface. The hamper should not be used, the bed should not be used. It should only be a clean work surface without clutter that gets fully cleaned and fully dried. Kelly's going to be my helper, so she's going to make sure everyone in the room gets masked. That includes the patient. Brianne is our lovely patient. And then as our work surface is drying, me and my sterile helper will make sure that we perform soap and water hand hygiene. Anytime prior to doing any sterile procedure, we expect a soap and water clean. And then your subsequent hand hygiene in between steps can be hand sanitizer. Once our work surface is completely dry, then we will set up our sterile field.
So you want to open the dressing kit and add additional supplies to the sterile field. Open the top flap away from your body. Place the sterile saline swabs, ChloraPrep sticks, and sterile gloves on a clean workspace. Throw the mask away if you're not going to use it.
I already have a mask on, so I will not use it.
Unfold the remaining flaps of the kit away from your body using the 1-inch border around the edge. So be careful only to touch the 1-inch border along the edge.
Notice how I'm positioning my work field. Where I always like to position where I have my patient and my sterile field, and all my dirty stuff's going to go out. I don't want my dirty anywhere to interfere with my sterile field.
So now you want to drop additional supplies needed in the center of the sterile field without touching the field or any of the supplies. Supplies should not extend into the 1-inch border of the sterile workspace. Don't turn your back on your sterile field. If your back is to your sterile field, you will not know if it becomes contaminated. So now you want to perform hand hygiene again and put on sterile gloves from the outside the kit.
I'll always make sure that I have hand sanitizer.
And you'll notice too that Renee's helper Kelly is putting on sterile gloves after performing hand hygiene, and she's going to use a sterile finger to help hold the PICC in place once the dressing's removed. So you want to use the sterile gloves you just removed from the kit. Make sure the glove packaging doesn't touch your sterile field.
The thing about these packages, you don't want your flaps to fall back on, so make sure that you kind of open them where it won't do that. Now we're going to remove our old dressing.
With your current gloves, remove the old dressing and securement device. Your gloves are no longer sterile, but since sterile gloves are not required, proceed with removing the patient's old dressing. You want to utilize sterile saline swabs and ChloraPrep sticks to aid in the removal of the dressing. And you can also use a roll technique when you're doing a 3M.
So whenever you're using ChlorPrep swabs, don't wet the top of your dressing. That separates your dressing. You want to get up underneath so that this is helping remove your dressing from your skin. And as Lisa said with the 3M, once you get it off there, this you can roll back. And it'll roll off the skin easily. Once your dressing is out and your securement is open, is when you can remove your securement. Now Kelly's going to be available to be my holder as I peel my dressing off the rest of the way. She'll use her sterile finger to walk up the length of the catheter. As the dressing gets removed the rest of the way.
So now Renee is going to remove her gloves and perform hand hygiene again. And put on some sterile gloves. And she will arrange and organize supplies on her sterile field. You want to arrange the field so supplies are easily accessible. Cut your steri strips, open your bio patch, tear your tape measure if you want to, and separate your gauze.
My first step, I'm going to put my sterile barrier under my patient's arm. Kelly's left hand, if your patient can't lift their arm, her left hand can help to lift the arm if needed on a smaller patient. So I'll arrange my supplies as needed. Prior to your dressing change, if you have a PICC, you always want to check your EVL before you begin, which I had done.
And she means check the EVL and EPIC.
Correct.
The previous EVL.
So now I'm going to clean. I want to remain sterile, so I'm going to use a sterile gauze to help hold my catheter as I clean so that I don't migrate. And I'm going to have Kelly lift so I can begin cleaning from the insertion site. So she'll lift up.
So to perform skin antisepsis, use your sterile gauze to pick up the PICC. Activate your CHG applicator. Use vigorous back and forth motion to scrub. Have second person move down the patient's line with a new sterile finger as insertion site is cleaned if necessary. Scrub the skin and the PICC lumens that will be under the dressing for 30 seconds with a minimum of 30-second dry time. Do not blot.
You want to make sure you get under your wings as well. And if you notice any areas of skin breakdown where your securement device was, or you need to reposition the wings so that you let an area rest, you should do so. Also clean the length of your catheter. Anything that's going to be under your dressing needs to be cleaned. Then we will do a 30-second dry.
And make sure you're watching the clock, because 30 seconds is a lot longer than you think it is in your head, so watch the clock.
Brianne is being a lovely patient.
So the next step would be to measure the EVL. You want to compare this measurement to the measurement that you looked at in EPIC prior to your dressing change. If the EVL is less than the last documented EVL, you can pull the catheter back to the last documented EVL. If it is greater, you just need to continue with the dressing change. You don't want to ever push a PICC back in.
Our EVL is 2, which is correct. Anytime I'm going to be touching this catheter, make sure you use a gauze and that gets trashed. Anything that you've used gets trashed outside of your field.
So the next step would be to apply your biopatch if appropriate. So you want to use the correct size biopatch. If the catheter is less than 6 French, use a small included in the kit. If it's 6 to 12, well, this is a PICC, so you're going to use the one included. So do not wrap the biopatch around a PICC line. Place the biopatch around a CVC if you have a CVC. Now you're going to apply steri-strips. Do not apply over the insertion site. Steri-strips must be inside the dressing. Then you want to apply your skin prep. Apply skin prep to skin area that will come in contact with the securement device and transparent dressing. Allow to air dry. Do not apply the skin prep to the insertion site. Then once your skin prep dries, you want to apply your 3M dressing.
So for your 3M, you'll first apply your securement device. On your securement device, it shows purple wings. That is where the wings of your catheter go. The rounded part is what goes towards your insertion site. So I've cleaned this area of my catheter so I can now touch it. That will go, my wings will go right where my purple wings are. My catheter will hook into my securement device. My top piece goes over to secure. Then I want to make sure it's on the skin properly where my catheter is not kinked. So right there looks good. The blue pieces, I will hold this here as I pull my blue pieces out on each side. And then be sure to use the warmth of your skin, of your hand, to make sure it sticks well. That's what's most important on a 3M dressing, otherwise you're going to peel. Then we'll put our top piece on. For our 3M, the full back of our dressing comes off. The end of our dressing here will line up with the end of our clear part of our securement device. So part of your securement does still stick out. This 3M you can lay down flat, you don't need to stretch it. Make sure it's positioned where your biopatch and insertion site is as close to the center of it as possible. Lay it down flat without stretching it. Your side piece will come off using the warmth of my hand. Your other side piece will come off, making sure it sticks well. Your pants piece then goes on. This as well goes up under your catheter and lays all the way up and flat down. No need for a chevron the way this dressing is designed. Again, using the warmth of your fingers. Then you would date and initial your label piece. This goes right over top as your closure method.
And also afterwards make sure that you document your dressing change on your flow sheet in Epic.
Then your dressing is finished. The only other important thing is to have a tuba fast covering it in case Brigham pukes on it, or to also prevent it from healing. You'd finish with a tuba fast. And you're done.
Beautiful.